she finally is noticing her results. She's finally noticing her stomach is going down. And it's been about close to 3 months, which is what we actually say. I mean, you can continue to see results up to 90 days after the last treatment. So
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Nicholas Romanelli, founder and operator of Body by Your Clinic, a med spa and wellness center located in Las Colinas, which is Irving, Texas. His greatest passion is helping patients truly achieve their goals, no matter how long it takes. He specializes in non-invasive aesthetic and wellness treatments using advanced technology. And he's proud to have built a bilingual clinic that connects with patients on both a personal and cultural level. So Nicholas, welcome and glad to have you here.
thank you so much for inviting me. I really appreciate it.
Yeah, so let's dive right into it. How did you first get interested in aesthetics and wellness?
So, we are a family-owned med spa, and my mother is Dr. Romanelli. I'm a little biased that to me, she is the best doctor in the world, but she is a family practice and internal medicine physician that actually invested in some aesthetic machines. They reached out to me. They kind of asked me, kind of her and my dad, they reached out asking if I wanted to maybe start this business that they had an idea for, a med spa with basically joining the aesthetic world, just head in, feet first, whatever, just right away. And that's essentially what I did. I said, yeah, I'll take the opportunity. It's been about 3 years now since I've been running Body by Your Clinic. And business is going good. I couldn't be happier. I'm grateful for it. So that's essentially how we kind of got into aesthetics.
Got it. Now, could you discuss some of the more common treatments that your patients come to you for? And also, why do you think that they're so popular?
Yeah, so our number one most popular treatment is Emsculpt Neo. That is essentially what it does is it builds muscle and it burns fat. I believe it's the most popular mainly because everyone wants to lose fat. Everyone always, wants to look better, feel better, which is what I want my patients to, feel and, achieve. But essentially the cosmetic side of it is the fat reduction. Now definitely, I think why it's so important is that not only will patients see a cosmetic and aesthetic benefit of burning fat, whether that be in your abs, in your love handles, in your arms, maybe even in the upper back area, more so in like the bra fat area. We can treat so many areas with these machines, with these services. So I think the customization and the definitely the convenience of targeting a specific area to helping our patients reduce, the amount of fat and toning up those muscles is definitely what makes Sculpt Neo the most popular treatment, not only for the treatment itself, but also for our weight loss patients, our patients who are on GLP-1s. They definitely, as they're on those medications, the amount of nutrition, the lack of nutrition more so that they have due to not being hungry or appetite loss, they are losing muscle, a lot of muscle mass, a lot of sarcopenia, as my mom would say. And that is something that we can, fight against and also help by doing these treatments to really build those muscles, work out those areas. And again, more so to make everyone happy, reduce the amount of fat that they have.
I think it's a very good point you bring up because a lot of people have now heard about the GLP-1s, the weight loss, but I think that's kind of the extent of how most people think about it. It's just, oh, I want to lose this weight. And then they get on these drugs, they lose the weight. But if they lost a significant amount of weight, now they need body contouring. So I think that what you brought up is something that's very important that a lot of people don't realize is that, okay, you get rid of the fat. Now, what do you do with that excess fat? And this sounds like it's a great option to have that second step of weight loss. Is that kind of what you would agree with?
Oh, absolutely. It's whenever weight loss patients specifically that start with Dr. Romanelli, normally what we do is they'll start the GLP-1s. Well, actually, our weight loss program is not only through injections. It's, there are other, drugs out there like Manjaro in the tablet form or maybe even phentermine. There are other weight loss drugs that when you meet with the provider, they really try and see, based on your labs, based on your medical history, what is going to work best for you. Now, when you actually start the weight loss program, about a month in, that's when we incorporate our treatments, Emsculpt Neo, to really target those excess fat or stubborn areas because stubborn fat is not just a mental thing. It actually does exist. It's why certain fat goes to maybe our stomach area, or maybe for some women, it goes straight to the thighs or to the underarms. There really is almost an unknown phenomenon of why it goes to those specific areas, but that really is, it does help with the reduction of stubborn fat areas that just won't go away.
Now, I know that you also provide M-Face, whereas Emsculpt Neo is a little bit more for the body and M-Face is more for the face. So I want to get your thoughts on this because a lot of different practitioners have these different, not maybe theories, but philosophies of the type of patients that come to their practice. Some have people that really just want to focus on the face because that's what everyone sees. Everyone's going to see your face. Not everyone's going to see maybe your entire body. Then others just get a lot of patients that really want to work on the body because that's something that they feel that is maybe a certain point or a certain area that they really just want to work on. So, in your experience, have you seen that most of your patients are coming in more for the body work or more for the face work, or is it split pretty evenly?
I would say right off the bat, more so body work. But what we notice with a lot of our patients is that they'll start on the body and then eventually want to do something for the face or something else. All of our treatments they are beautifully synergistic, so they go hand in hand with one another. Kind of continuing on, the GLP-1s. There is in the industry, there's a thing called Ozempic face. I've heard some physicians say, some things that they agree with it, some don't. Basically, whenever we have the lack of nutrition or when we lose a lot of weight with drastic weight loss, our skin, our face shows that as well. So, M face, which is just like Emsculpt Neo, it builds muscle or it tones the muscles of the face, helping naturally lifting the face, kind of like a what they kind of call a kind of like a mini facelift, obviously a non-invasive facelift. So we do that one. I mean, really, it's people start on their body and then they eventually want to then go up to the face. It's almost like once they have their most, I guess, insecure area or the area that really causes to kind of like attack their confidence. That's where I like to focus first for my patients. Because some people will come in for everything. They say, I want to change it all. And it's like, okay, let's start where's number one, and we'll go down the row and we'll help you with everything. But I would definitely say body is our number one, and then face right after it.
Got it. And just to be clear, when you say the M face, it's more for lifting because you did mention like the Ozempic face where kind of they look a little bit hollow, a little bit shrunken. I think that's kind of a big differentiates to make. Like, what does M face really do? Because you don't really want to look like you're a skeleton. But what is I think not everyone has heard about M face, so it sounds like it's more lifting, like you mentioned, like a mini facelift.
Yeah, exactly. I mean, so essentially, M-Face combines high fez, high intensity focused electrical stimulation, whereas Emsculpt Neo was electromagnetic. Since it's bigger muscles, we do need a bigger magnetic power. But with M-Face, it's electrical stimulation. So we are stimulating the zygomaticus major and minor and the rosaris, which are muscles that help essentially lift the face. Now, definitely with Ozempic or with drastic weight loss, you can get that sunken in look. The patches that we put on your face that help essentially build muscle or really tone the muscle, they do also emit radio frequency. And we get a lot of patients that get scared because they're like, oh my gosh, are you burning fat in my face, like making me look even more concaved or more skeletal like? And is no, it does not emit the amount of radio frequency to cause apoptosis, cell death of the fat cell, or to cause lipolysis. But what it does is enough radio frequency to cause collagen remodeling, collagen rebuilding, as well as elastin. So not only will we be helping lift the face from the muscular layer, but also tightening the skin as well, an overall rejuvenation. So kind of again, how the face starts to fall, we have natural, beautiful pockets of fat in our face that are right up here. This is what helps us fill up our under eyes. And so whenever our facial muscles start to weaken, those fall, and so do those. Those almost lower. So all that natural fat that we have in our face, sometimes people will get filler, when in reality, if you just strengthen that muscle again, you can help naturally fill up those under eye bags that are really concave or just a lot of skin laxity due to the fat loss in the face or just facial drooping. So, I mean, these treatments really do help not only enhance our natural beauty, but also if you still want to get filler, you can now get less. I mean, it's up to, they've seen up to 1.3 cc's of volume they've seen an improvement of 1.3 or 1.5 cc's of volume in the face by naturally, like from the M face treatments.
Okay. Now, and thank you for clarifying that. Now, I want to move into the topic of any new or emerging treatments that you're seeing that you're particularly excited about. I did want to talk about Emcella, which helps people with incontinence. So, could you tell or explain a little bit more about that?
Absolutely. Emcella is that is probably my favorite treatment, um, because that's actually the machine that Dr. Romanelli, that was what made her decide to invest in these machines in general. We have 6 machines right now, but Emcella was the main reason she decided to buy almost kind of like a starter pack of 3 of them. Again, because of muscle building, Dr. Romanelli, as will I, will always suggest if we can strengthen your muscles, if we can build it, yes, let's go for it. Let's do that. When it comes to Emcella specifically, when we strengthen the pelvic floor, essentially we're giving you more control over your bladder, helping you with incontinence. And incontinence, over the years that I've done these treatments for my patients, it really is like a silent, almost like a silent disease in a sense. Not really in a disease, but just like a silent confidence killer. So Emcella really is a aid to incontinence, and incontinence, I believe, is a silent confidence killer. It it affects people more than they think it does. So I have so many patients, so many mothers, so many women who maybe never had kids who think it's just a part of growing, just a part of being a woman when it's not. I mean, you shouldn't wet yourself. Leaking is not just a part of motherhood. It's not. So yes, it's a common symptom. It's a common thing that happens after, after giving birth, after the beauty of childbirth. But when you can do, or when you have a treatment that can do, very intense Kegels to strengthen the pelvic floor, giving you more control over your bladder, it alleviates so much stress that you probably didn't even realize you were adding to your life. I have patients who constantly have pads in their purses. They also have a box of pads in their car. They also have a change of clothes in their car, just in case if they leak too much. They also have an extra pair of underwear. It's the lengths people go to in order to make sure that their life is revolved around incontinence is is honestly insane. I mean, it it really does affect people. I mean, they'll walk into a restroom. Where's the nearest bathroom? I just want to make sure I'm sitting close to it. Because my question I even have for not only female patients, but male patients, I'm like, would you like to sit through dinner without having to get up to go to the bathroom? I mean, maybe at least once, because that's a mini sign of incontinence, of, urge incontinence, not being able to hold your bladder for an extended amount of time. It helps people in so many ways. And all we're doing is strengthening the pelvic floor. So it's amazing. You can sleep better, you can sleep longer, you don't have to wake up in the middle of the night because you have to go to the bathroom. I mean, such a simple muscle that we're strengthening. It's amazing how happy our patients are, especially the confidence that they get when they come in. And that is what just makes me so happy. I love helping them with such a problem that they might not have realized really took a toll on their life, on their social life and emotionally and physically.
Yeah, I mean, I can just imagine someone having to deal with that all the time, and it seems like a small thing, but it's something that just kind of eats at them over and over and over and over and over again. And if you're able to solve that problem for them, I can see how it can completely change their life. So now, Nicholas, I want to dive into really what differentiates your practice from others in the industry. You mentioned to me before the podcast started about patient loyalty. Some people have been coming to you for 2 years plus. So could you talk a little bit more about that?
Absolutely. So, well, almost initially to say I'm Puerto Rican. My Dr. Romanelli is Puerto Rican as well. We have six providers here. On our side, at least on the medical office, they have six medical providers, all female. Um, 5 out of 6 fluent in Spanish. So I would definitely say something that sets us apart is that we are, bilingual. We have more than 50% of our patient clientele is Hispanic. So definitely when it comes to patient care, we have kind of like that leverage a little bit where we can, help out people of all walks of life, especially when it comes to, not only language barriers, but even cultural barriers. There's a way to talk to, a patient that I know is Puerto Rican versus a patient that I know that grew up in Boston. So I can communicate with them a little differently and make them a little more comfortable, maybe make them a little more at home. And again, that almost then builds on the loyalty. So we've had patients. I mean, again, I've been running Body by Your Clinic now for 3 years. It was 3 years of this month in June. And so I've had patients now that have been with me for a little over 2 years, and it makes me happy. I mean, it's nice to know that the care and that the loyalty that I want to give to my patients is palpable and visible, not just something of, oh, he's just trying to make money. Like, no, I want to actually make sure my patients are happy and confident when they walk out of here and when they come back and then go again. So I want to make sure that they know that we can help them at all points of life.
Now, I'm sure that this is probably going to tie into my next question as far as if you can explain how you approach educating your patients about the services you offer, the benefits that go along with it. And I'm sure that because people stay with you for so long, you're giving them the education, you're guiding them through the path, and things change aesthetically, things change health wise. And so I think it's a testament to people staying with you for long periods of time that you are educating them and guiding them properly. But would you mind just explaining a little bit more about your approach to that?
Absolutely. That is a great question. So when it comes to educating the patients, I believe that is the number one thing, the most important thing when it comes to not only making the sale, of course, from a sales perspective, but again, from building that loyalty. When your patients understand, first of all, why they have what they have or why the problem that they have is happening in the first place, how you can help that problem, and why this problem is the best or why this solution is the best outcome to help with that specific problem. It's really that's more so how I do my consultations. All I'm doing is educating my patients on how the services that we have can help them with their issues. Now, if they have an issue or a problem that I know for a fact that none of my treatments can solve, I will let them know. And what I'll do then is actually, if it's more so medically related, I'll walk with them to the front office of the medical clinic and I'll book them an appointment personally with one of the providers because I'll make sure that if I can't help them, I'll point them in the right direction to someone that can. So, yes, I believe educating our patients is probably one of the most important things, really just to make sure that when the patient understands what they're doing, they're a lot more comfortable with it. I mean, you have to think if you're in times of like when you're uncomfortable with someone, it's probably because you didn't know what was going on or you were overwhelmed or you're just like, what is happening? If you can explain to your patient, hey, this is why, you need this. I can help you with this. Explain A to Z, then bam, they understand it, they're happier, they're more receptive to the treatment versus skeptical. So that's definitely when you have a patient that understands why they're doing it, it makes it 10 times easier.
Okay. Now, Nicholas, I'm sure that over the time that you've had the practice, you've gotten a lot of people coming in with maybe they have different misconceptions or different beliefs that are maybe not necessarily right about what you do, about the treatment you provide. So, could you share some common misconceptions that you hear often from patients that come into your doors?
Absolutely. So we'll have a lot of patients that understandably will come in for a consultation. Maybe let's say it's about Emsculpt Neo to build muscle and burn fat. They'll look at me and they'll point to their stomach and they'll say, I want to get rid of this, all of it. And I will, very nicely and caringly let them know that we can help them with that. Now, a misconception that people have, and that I always, again, when it comes to educating the patient or just letting them know realistically that depending on the amount of fat that is there or the amount of treatments or maybe the amount of, depending on the results that they're wanting, when it comes to Emsculpt Neo, people think that, oh, I'm gonna get rock hard abs. You're gonna see them with just maybe two, three, four, maybe six treatments. No, that's not the case. That's not the case. It's not gonna happen overnight. And I can easily explain it like going to the gym. You don't go to the gym once and you're like, oh my gosh, wait a second. I think I see my six pack. Like, wait, it's there. It's like, no, that's after months, maybe even years of working out, of going to the gym, taking it seriously, dieting, exercise, working on your mental health. There are so many aspects to self-care that matter to really see actual good results, which even with our skincare treatments, we partner with SkinCeuticals. We use their products. They are the number one US medical grade skincare brand worldwide. Absolutely love them. I mean, what you do outside of the office after your treatment is 10 times more important than what you do when you are here. Because I'm giving you the treatment and we're doing, Emsculpt Neo on your abs. You're doing the equivalent of 20,000 crunches in 30 minutes, which that does sound like a lot and it is. But after we do that, we're stimulating your body's natural ways of building muscle and burning fat. So now, as long as you don't go out and get a margarita right after, or as long as you don't maybe just go home and lay down and become a couch potato or think, well, I worked out this week. I did 20,000 sit-ups. It's like, no, 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 no. This is not a substitute for working out. This is a catalyst to achieving your body goals, essentially, faster. So that is definitely the biggest misconception that I try to nicely and very kindly remind or let my patients know that while we're not going to be getting rid of, your beer belly or whatever right away, we will be helping reduce the amount or reducing the size. And, which will definitely help you with your cardiovascular health, metabolic syndrome, help you with so many, health situations, health risks like that. But sometimes patients, and sometimes patients don't care. They're like, that's okay. I don't care about cardiovascular health. That's fine. As long as I get rid of my stomach, it's like, okay, got it. So that would definitely be the biggest misconception that the results are instant or that they're going to even last forever. I mean, you go to the gym again for a year. Let's say you go to the gym for a year consistently, 5 days a week. You're going to see some good results, some good improvement. And then let's say, well, I worked out for a year. I don't need to work out again for another 3 or 4 years. It's like, no, no, you need to continue. That's the whole point of even self-care, but also discipline. These treatments, they give you a little bit of leeway, a little bit, but it really is discipline is something that is still needed. So I would definitely say those are probably some big misconceptions that I explain to a lot of patients about.
Got it. Now, I want to understand, I guess, how's your viewpoint? Because when people think about medical treatments, they're thinking that there's a process, there's a protocol, there's a procedure. But what role do you believe creativity plays into how you approach your patient care?
First off, when we're thinking of, what treatments synergistically will be best to help you achieve your goals fastest or help you achieve your goals in general. Um, so I think thinking creatively, of course, medically, but I would say creatively almost the way you even approach the treatments, the way you tailor them, understanding that, hey, what medications are you currently taking? What skin conditions do you have? What surgeries have you had in the past? What implants have you had? Do you have a pacemaker? Do you have a loop recorder? You know, do you have anything in the GI tract? Do you have, a hip replacement? Do you have a knee replacement, shoulder? It's almost like finding out, like, okay, who are you? What have you done? And how can let's think creatively to how we can use these treatments to still help you with, the areas that you want to treat. So I really think, creatively, it's fun coming up with like tailoring packages for patients, especially even when it comes to skincare. Because sometimes patients, they are only doing their abs. And I have a lot of male patients who are doing their abs. They're, helping get rid of their beer belly or muffin top or whatever sayings people like to use for that area. And I'll give them, a little sample of a product we have called PTOX, which is almost kind of like Botox in a bottle, but not because, Botox is a lot more aggressive, a lot more, it actually does paralyze the muscle. But I digress. I'll have some of the manliest, men who you would never even think they cared about, skincare. And I'll just give them a little sample. And then they'll come back and they'll be like, hey, so what was that product that you gave me? Because I kind of like my wife said something about my skin looking good, and now she wants to get it. So it's like creative ways of just playing into kind of like, hey, you know, I think this would be good for you. Like really just having fun with the patient. So helping them in ways maybe that with certain things they might not have even noticed. So I think that's where creatively it's a lot of it's fun. The med spa industry it's saturated, but it's fun.
Now, Nicholas, I'm sure that you've had some challenging cases come through your doors over the years. So, is there maybe one story that stands out to you of someone that came in, it was a tough situation, and how you were able to get them a successful outcome in the end?
Yes, there's actually a patient who we're still seeing her. She is a patient currently. Um, she recently, when she started with us, it was with Emsculpt Neo to build muscle, burn fat, reduce her belly area. Basically, to put it candidly, she was like, well, when my stomach became bigger than my bosoms, that was a problem. She was like, I did not want that. And I was like, okay, you know what? We'll help you out. She was already a patient of Dr. Romanelli's using, Ozempic and, well, now I believe it's semaglutide or one of those molecules that they sell in office now. And she was seeing very, very slow results when it came to weight loss. So we started our treatments with her, and I'll let you know that she actually had just turned 80. Like literally she had turned 80 by her second treatment of Emsculpt Neo. And we knew that already, and so we did let her know, I let her know that while these treatments do take time to see results, age plays a huge, huge factor in that. I mean, you think everything slows down with age. Collagen production, elastin production, that's just for the skin. Fat reduction, fat burning. All of our bodily processes, those slow down with age. So even the results, they take even longer. Now, she was, let's just say she didn't notice the results. She wasn't seeing any results. She had finished. She was not happy. And, I had her before and afters, and you noticed some slight differences, but with the amount that she had paid, I understand. I understand it completely because she's wanting to see good results. So, I told her again, let's take some time, keep doing what you're doing with, the medication, keep going at it. This woman had her T's crossed and her I's dotted. She had a diary of what she ate every day. She was doing what she needed to do. But yet we were even wondering, me and Dr. Manelli, like, is something medically wrong? Like, is everything okay? Like, why is she not? She was losing maybe 1 to 2 pounds. I think almost like the max was 4 pounds in a month. Maybe that, whereas sometimes patients lose 10 pounds in their first month. So that was definitely a big situation or kind of a struggle. But, to make it basically to say happily that, about a couple of weeks ago, I believe it was literally 2 weeks ago, I heard some news from Dr. Romanelli that the patient weighed herself and she also measured herself. She's already down almost 3 inches off of her waistline. She is down almost about a little over 10 pounds, which from the beginning, I mean, for the lack of weight she was losing, she finally is noticing her results. She's finally noticing her stomach is going down. And it's been about close to 3 months, which is what we actually say. I mean, you can continue to see results up to 90 days after the last treatment. So the fact that I'm now getting her to be happy and, understanding that like, okay, I guess it does take a little bit of time, but she definitely was her body at first was we weren't sure if there was medically something, but that was probably one of the most difficult situations where the weight was not coming off. It almost just took like a good couple weeks to where it just changed. And then she finally started dropping. So, which that gave me the biggest sense of relief. I was like, oh, thank God. Okay. She's losing weight. It's good. It's good. So yeah, that would definitely be so far, probably one of my biggest detriments to an achievement. So yeah.
Okay. Now, Nicholas, where do you think the future of aesthetics is going?
Well, I mean, it's already almost here. It's they've released a lot of new technology that has to do with depression and for the brain, neurological stimulation. And there already are treatments like it. I believe it's TFUS energy, basically to target certain areas of the brain to almost like not almost kind of like Emsculpt Neo for the brain, but nowhere near the amount of intensity. While we don't have that treatment, that is something that I've seen quite a few companies that produce these machines or devices that we end up purchasing. A lot of things have been going towards mental health, which is something we're already helping by helping the way they look and the way they feel. But when they're literally targeting the brain, I'm kind of like, okay. And I mean, they're helping, surprisingly, a lot of these treatments are helping with like nicotine addictions, with more so like tics or just urges, struggling with addictions, almost with depression as well. I was surprised to see med spas now offering treatments for depression. I was like, what? I was like, okay, wait a second. I guess it's, I was surprised, but I definitely see, the industry leaning more towards mental health and I think that's amazing because mental health, as we've seen after the pandemic, super important, just as important as any other health in our body. So yeah.
Got it. Well, Nicholas, I have one last question for you, but before I ask it, I want to point people to your website at bodybyyourclinic.com. Now, last question is, what is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure or treatment done, but isn't sure which provider to choose?
While a lot of our patients, more than half, prefer Dr. Romanelli because she is, she's been a practicing physician for over 20 years. Um, while a lot of patients prefer her just because they've known her maybe the longest, I would definitely say whatever provider makes you feel comfortable to explain what's going on. There are some providers, I get shocked that there are certain doctors out there that, will ridicule their patients or not even ridicule, but they won't make their patients feel comfortable or even safe enough to let them know, like, hey, oh, by the way, I'm dealing with this or I'm struggling with this. When you have a provider that you aren't worried to let them know maybe that you messed up. Maybe you fell back on a thing. Maybe you forgot to take a medication. Maybe you gained weight and you're just petrified of her seeing the scale go up instead of down. When you have a provider that you can trust to not shame you, not make you feel guilty for being human, not make you feel guilty for not being perfect, which no one is, and neither are they. They struggle just as much as we do. So when you have a provider that gets that across and makes you feel like you're truly cared for, that's that's I would say the biggest thing to look for. And Dr. Romanelli, I could say hands down, when she cares, she cares. Which she does actually. Some patients are nervous. They're like, "Oh God, I'm nervous to talk to Dr. Romanelli. She's going to be disappointed in me." And then they'll see her and she's fine. She'll keep it real. She'll tell them, realistically what they need to do. But I would definitely say look for a medical provider at your clinic that makes you feel heard and listened to and respected. Because you're going to respect them because they're a doctor, but they need to respect you because you're a human. So you're a human being who deserves just as much respect. So I would say a doctor that you feel comfortable with and at home.
Got it. Well, Nicholas, thank you for being here. Thank you for sharing your expertise. Where can people contact you and the practice?
Absolutely. So they can contact us, Body by Your Clinic. We are in Irving, Texas, in Las Colinas area, like you said previously, outside of Dallas. But they can contact us on our number, on our website. They can contact us at 972-584-0500. That is our number. You can call us, they can text us. We actually almost get a lot more texts than calls. So whatever's easiest for our patients to reach out to us. And then we also have some patients that like to follow us on Instagram, Body by Your Clinic. And that's where we actually announce our promos, our sales, all of that. So definitely, I would say the best ways to contact us are through our number and through our Instagram. So yeah.
Okay. Well, Nicholas, thank you again for being on the show and sharing your message.
Thank you so much, Daniel. I really appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.